We need initially to assess that type of hair loss, the extent of the hair loss, and then in that we can have solutions after the assessment. One, what I say the primary one is we have a procedure that we call scalp micropigmentation. This is a procedure, it's a non-surgical, non-invasive procedure that we do. So it does not involve bleeding, it does not involve any surgery. One of the most safe procedures, where we introduce a hypoallergenic pigment. It's made from a hydrocarbon, it's a natural pigment, hypoallergenic, that mimics the strokes of hair. We bring in this as our number one because we look at also the cost of the procedure. Two, we look at hair transplant, what people locally call hair transplant. It's called FUE, follicular unit extraction. So in some instances, we see people have lost hair even from the donor site. When we're doing a follicular unit extraction, we are transplanting follicles, not hair. We harvest the follicles, but there we find people that have lost hair even from the donor site. So they have we only transplant to you your own follicles. Without the follicles, we can't have a hair transplant. And there are people who have hair loss to that extent, and they also need a solution. So there we bring in integral micropigmentation that covers any type of hair loss.
Okay.
Yes.
Is this change communicated clearly to the person who is coming to receive the treatment? And if yes, what are usually their expectations before and after?
Well, we always have to explain to our clients, consent with them, inform them about all the procedures we're doing. Because if you have, hair loss has a couple of things that we grade it in. You could have lost hair in your hairline, basically hair loss at the hairline. You could be having what we call thinning hair. You could have partial baldness or full baldness. So you come in, we discuss with you all the treatment options or the plans that are available and what we can do about it. We even give you adequate information that we give you a chance to also go and Google about it. That you come with an informed decision on what you can do, we can do with you. So we give you the best information available, give you time to digest the information, that you make an informed decision on what procedure we can do.
Okay. Doctor, let's talk about number 3, which is, and I want to take you straight to this point of, can you tell us about the time when you demonstrated leadership skills in that area of cosmetic dermatology?
The time when I demonstrated the leadership skills?
Yes, when you recall that this is the time I began to demonstrate that I am a leader in this field and I want to actually take this serious.
Well, I would stand out proudly and say I'm pioneering cosmetic dermatology in the country.
Okay.
At the professional basis.
Wow.
When people hear the word cosmetic dermatology, many relate it to cosmetics, but it's not basically cosmetics. It is not the cosmetics.
Yes.
Cosmetic dermatology can also be known as aesthetic dermatology, where we go beyond use of medicines, where we can do procedures to improve on the beauty of someone. For example, I would say, if you came in with a skin problem, so I would give an example of pimples. What else can we do without giving you medicine? Tablets and pills. And if you came in with hair loss, what can we do? Because the normal protocol when you're losing your hair, we would say take some biotin, do some minoxidil, and people have done that for a long time. So in the cosmetic dermatology, as a pioneer, I want to think of what more can I do apart from the usual things any dermatologist would prescribe for you, the pills, and then what more can I do to enhance this? So in researching more and digging deeper into this, I'm leading.
Wow. At what point did